Greetings from our nation's capital. My name is Simit Pandya, and I'm a Federal Affairs Principal at the American Nurses Association. I am thrilled to hear that you plan to come out to Washington, D.C. to participate in ANA's 2024 Capitol Hill Day. Your advocacy will complement our team's ongoing efforts to represent the nursing profession in Capitol Hill. In this video, I will cover ANA's work to restrict the use of mandatory overtime for nurses. Regulations to limit work hours have been in place for almost a century in certain high-risk occupational settings, including the aviation, trucking, and maritime industries, where long work hours can adversely affect performance and safety. Unfortunately, the healthcare sector has been slower to adopt work hour regulations. In the nursing profession, nurses often work 12-hour shifts as an industry standard. Very frequently, nurses are required to work beyond their 12 hours because of staffing plans that look at the hospital's bottom line rather than what's better for patients and nurses. And many times, nurses also go without adequate time off to rest in between shifts, leading to fatigue and burnout. Currently, 32 states have no laws or regulations prohibiting mandatory overtime. As you know, nurses who work extended hours without adequate rest often experience fatigue, poor sleep quality, impaired alertness, and burnout. Such conditions can result in unintended harm to nurses and their patients. In fact, working overtime is shown to increase the risk of treatment and medication errors, patient dissatisfaction, injuries to patients, and even death. Additionally, burnout resulting from excessive work hours is causing nurses to leave the workforce. That causes more staffing shortages that result in even more frequent use of mandatory overtime, and it creates a vicious cycle without relief. To date, 18 states have passed laws to restrict the use of mandatory overtime for nurses. Unfortunately, these laws vary with respect to work hour restrictions and enforcement. Congress must pass legislation to establish uniform restrictions and enforcement related to mandatory overtime. Fortunately, ANA is working with a bipartisan group of congressional champions in the House and the Senate to pass the Nurse Overtime and Patient Safety Act to restrict the use of mandatory overtime for nurses. Specifically, the measure would prohibit healthcare facilities from requiring nurses to work more than a previously scheduled work shift, 48 hours in any work week, 12 consecutive hours in a 24-hour period, or during the 10-hour period immediately after a 12-hour shift. While the bill restricts the ability of healthcare facilities to require nurses to work overtime, it does not prevent nurses from voluntarily choosing to work overtime. The bill also includes whistleblower and non-discrimination protections for nurses who report non-compliant employers, transparency requirements for covered health facilities, and civil penalties that apply to facilities that have been deemed to be non-compliant following an enforcement proceeding. It would also require the Agency for Health Research and Quality to issue a study on standards for safe working hours and the use of mandatory overtime. The House version, H.R. 7546, was introduced by Representatives Doris Matsui and Jen Kickens. The Senate companion, S. 3860, was introduced by Senators Jeff Merkley, Chris Van Hollen, John Fetterman, and LaFonza Butler. By co-sponsoring this bill, your elected members of Congress would support this effort to improve the work environment and well-being of America's nearly 5 million registered nurses, which would in turn help alleviate our nation's nurse staffing crisis and the corresponding risk to patient safety. Restricting mandatory overtime and improving baseline staffing levels will make hospital work environments more attractive to nurses and stop them from fleeing to other nursing jobs or leaving the industry altogether. Well, do you feel overwhelmed with all this information? Don't worry about it. Prior to your congressional meetings on Capitol Hill, you will receive a packet of materials that includes an issue brief on the Nurse Overtime and Patient Safety Act. We look forward to seeing you on June 27th, and thank you for your advocacy on behalf of the nursing profession. Please visit rnaction.org to learn more about this bill and ANA's other legislative priorities.